9:13 now. It's Health Literacy Month. Health literacy means choosing over-the-counter medicine, scheduling appointments with relevant doctors, or following doctors' instructions. 12% of American adults are said to be proficient in these tasks. Dr. Sarah Schwertner from Primary Care joins us to talk about this and an important issue. So, good morning, Dr. Schwertner. How exactly would you define health literacy?
So health literacy is basically saying knowing where to go to find out health information and knowing how to use that. So kind of like you said, knowing what doctor to go see for certain conditions, knowing what medications over the counter to take, those kind of things.
And then kind of also describing what you're experiencing to a doctor, which seems, pretty obvious. I've got a stuffed up throat, but sometimes people can have trouble really kind of explaining to the doctor what they're feeling.
Yeah, so, sometimes when people don't have the right knowledge, they might describe something that doesn't actually fit to what their diagnosis will be. So somebody who has a sore throat may come across that they have upper respiratory infection, but actually it's reflux. So things like that can be confusing between patients and physicians.
Or realizing that you have it for that matter. Maybe you've had it your whole life and didn't realize that you were not unique, but have something different than a lot of people have.
Right.
So from a doctor's standpoint, I always say the doctor is the person that gave up his or her 20s. You come in there armed with lots of information. Can you generally detect when there's a blank stare or something as you're trying to explain to us lay people what you're saying?
Well, yeah, I try to kind of gauge where the patient is. And a lot of times a good thing that I do is ask them if they understand what the treatment plan is. And that really gets good feedback. Sometimes I'll even ask them to explain the treatment plan in their own words in case there's any miscommunications.
So, where do you go to get information, some accurate information? If you're, if you're up in the middle of the night and you've got some condition or whatever.
Right. One of the great resources that I also inform my patients to go to, PubMed is a really great website, .gov. There's cdc.gov. Also, some of the universities, medical schools like Johns Hopkins have really good information that you can read up on and ask your doctor about if you're concerned about symptoms that you may be having.
So if somebody wakes up in the middle of the night, why is my heart racing? Obviously, go to somebody that isn't necessarily trying to sell you something.
Right. There's a lot of places that have misinformation out there. So you want to be really careful that whatever website you're looking under, they have resources attached to them. And sometimes there's articles that can be somebody's medical opinion.
You had a great line when we were talking during the commercial break about Dr. Google.
Yes. So I always like to be very polite and tell my patients, Dr. Google doesn't work in my clinic.
So,
unfortunately, people do Google, which is a great resource as long as you know what websites you're going to. One thing, definitely don't trust medical advice on social media. That is one of the platforms that there isn't a lot of resources with, unless it is attached to something like a .gov or PubMed or something like that.
Wait, okay, so what you're saying is don't say that guy on Facebook said that about my brain health or whatever.
Right. Yes.
All right. Probably good advice. Dr. Sarah Schwertner, thanks so much for
having me on the show.
Health Literacy Month. Thanks a lot.